Every dentist will tell you that saving a tooth is always the goal. I used to say the same thing, I don't anymore. And if you've been through crown after crown, root canal after root canal, and you're still sitting here wondering why nothing has held up, what I'm about to show you might be the most useful thing anyone has said to you about your teeth. I spend my days looking at the bone and the gum tissue that determines whether a tooth has a future. I can read a periodontal chart and tell you with clinical precision whether a tooth is worth saving at all. And what I see in those charts has changed how I practice completely. After all of that, I have one clear position on this debate. But before I give it to you, I want to show you something about the save everything instinct that nobody in dentistry likes to say out aloud. Because once you understand it, the decision stops being emotional and starts being obvious. I'm going to walk you through the honest case for saving teeth, the honest case for removing and replacing them properly. And then I'm going to tell you exactly how I make the call in my own clinic. Point 1. The case for saving. The instinct to save a tooth is not wrong at all. A natural tooth, healthy and stable, will always outperform any replacement. Your own tooth root sends pressure signals into the jawbone that keep it dense and full. It fits your bite in a way that took years to calibrate. It's yours. And the idea of removing something that's still there, still functional, still salvageable, feels like giving up before you've exhausted every option. And that instinct comes from a good place. Save the tooth became the default position in dentistry for legitimate reasons. For most of dental history, the alternatives to saving were far worse. A missing tooth meant a gap, a denture, or a bridge that ground down healthy neighboring teeth. Saving was almost always better than the alternative. And that thinking got baked into how dentists are trained, how practices operate, and how patients are advised. Now, the problem is that the alternatives have changed dramatically. Here's what the save everything instinct misses. A tooth doesn't exist in isolation. It sits in bone, surrounded by gum tissue, connected to adjacent teeth. And when a tooth has been through repeated trauma, repeated infection, repeated intervention, the damage doesn't stay contained to the tooth itself. Every failed root canal leaks bacteria into the surrounding bone. Every retreatment removes more tooth structure. Every new crown placed on a compromised root takes more of what is left away. The tooth might still be there, but the foundation it sits on is getting smaller every time someone tries to save it. Saving a tooth that has no future doesn't buy you time. It spends bone you cannot get back. Now, none of this means saving the tooth is wrong. For teeth with a solid foundation, adequate bone, and a genuine long-term outlook, saving is absolutely the right call. The question is, what happens when those conditions no longer exist and nobody is being honest about it? Because there's another side to this, and it's the side most patients never get to hear properly before they agree to the next repair. Point 2, the case for removing and replacing. A well-planned implant in a well-prepared site does something that no amount of repair work on a failing tooth can do. It replaces the root, it sends loading to the bone, it stops the deterioration that begins the moment a tooth is lost or removed. And because it's not connected to adjacent teeth, it doesn't put them at risk. Done well with proper planning and proper bone assessment, an implant gives you a fixed long-term solution that functions like the real thing and protects the jawbone around it. Now that's a better outcome than the tooth you were trying to save. Implants have become a genuine clinical option rather than a last resort because the technology has now caught up with the ambition. With digital planning, 3D imaging, the ability to map bone volume and design a restoration even before the surgery begins. All of this has made implant placement far more predictable and more precise than it was even a decade ago. Patients have started choosing them not because they gave up on saving, but because they understood for the first time what replacing properly actually meant. However, an implant needs bone to work with, and that bone is exactly what gets lost when a failing tooth is kept in place way too long. Every month a tooth with advanced bone loss sits in the jaw, the surrounding bone continues to deteriorate. What may have been a straightforward implant site 2 years ago now becomes a complex grafting case today. The window for a clean, simple solution closes quietly, and most patients don't find out until they're sitting in front of a specialist being told the treatment they need is now twice as involved as it would have been. So ultimately, the longer a failing tooth stays in place, the harder the implant case that follows it becomes. This isn't an argument for removing teeth aggressively or prematurely. It's an argument for honest assessment of when saving has stopped making clinical sense. And those are two completely different things. And the difference between them lives in the periodontal chart, which brings me to the specific variable that determines where that line actually sits. And this is the part most patients never get access to before they make their decision. If this is giving you a clearer picture than any conversation you've had in a dental chair, hit subscribe. Every week, I put out videos designed to give you the information you need before you make a decision you can't easily undo. Point 3, the real variable most people ignore. You've heard the honest case for both. Saving makes sense when the foundation is solid. Removing and replacing makes sense when the foundation is gone. The problem is, most patients have never had anyone actually measure that foundation and tell them plainly which side of the line they're on. Here's how I assess it. 3 questions I ask before I make any recommendation. Number 1, has anyone ever done a full periodontal assessment on this tooth? Not a visual check, not a quick probe in one spot, but a proper measurement of the bone levels and pocket depths around every surface of the tooth. If the answer is no, you do not yet have the clinical information needed to make this decision. Number 2, how many times has this tooth been treated in the last 5 years? And what was the outcome each time? Because a tooth that's failed twice under the same treatment is telling you something that another round of the same treatment will not fix. Number 3, when you look at the 3D scan, how much bone's left around the root and how much has already been lost? Now that number tells me almost everything about whether saving is still a meaningful clinical option, or whether it's become a way of delaying a decision that's already made. If a tooth's never had a proper periodontal assessment, if it's failed repeatedly under treatment, and if the bone around it has dropped significantly, saving it is not the conservative option, it's the most expensive option. Every additional intervention costs money, removes more tooth structure, and spends more of the bone that the eventual implant will need. The conservative option in that situation is to stop, assess properly, and make the right call once. Now I'm going to tell you exactly where I land on this, and I'm going to be very direct about it, because after 25 years, I think dancing around it doesn't help anyone. Point 4, the verdict. For teeth with advanced bone loss, repeated failed interventions, or structural compromise that's reached the root, removal and implant replacement is not giving up. It's the smarter clinical decision. Doing the right treatment once is almost always better, cheaper, and less stressful than years of temporary fixes on a tooth that has no long-term future. That's not a controversial position. It's what the periodontal chart tells me every single week. I see this pattern constantly. Patients arrive having spent significant amount of money over years on crowns, root canals, and repairs on the same teeth. By the time they reach me, the bone loss is significant, and the treatment they need is far more complex than it would have been. And they say the same thing every time. I wish somebody had told me this much sooner. And not one of those patients is angry about the decision to remove and replace. Almost Every single one is just frustrated that nobody made that recommendation before the situation became as complicated as it did. What changes when the right decision gets made at the right time is not just clinical, it's financial, it's emotional. The patient who stops the cycle of repair and gets a properly planned implant solution stops dreading their next appointment. They stop budgeting for the next thing to break. They start eating what they want, smiling without thinking about it, and living without the low-level worry that failing teeth produce every single day. I hear the same sentence from those patients consistently. They wish they'd done it sooner. The most expensive dental decision most people make is not the implant, it's the years of repairs that came before it. Knowing this is one thing, knowing what to do with it before your next appointment is what actually changes everything. Point 5, how to act on this. Now tonight, before your next dental appointment, write down 3 questions and bring them with you. Number 1, based on bone levels around this tooth, is saving it a genuinely long-term solution, or are we just buying time? Number 2, if we remove this tooth and replace it with an implant, what does the process actually look like? And what's the total cost compared to continuing to repair? Number 3, if we keep repairing, what's the realistic outlook for this tooth? 5 years? A clinician that gives you a straight, honest answer to all 3 is worth trusting. A clinician who moves past them and books you in for another crown is the signal to get a second opinion before you spend another penny. Continuing to repair a tooth that's got no future is like continuing to patch a roof that needs replacing. You can keep the water out for another season, but every patch costs money. The underlying structure keeps deteriorating, and eventually the repair bill exceeds what a new roof would have cost in the first place. Your teeth work exactly the same way. So you came into this video carrying the idea that saving a tooth is always the right call. It's not always the right call. And the patients who found that out too late are the ones who paid the most, waited the longest, and ended up with the most complex treatment. You now know what question to ask before you agree to the next repair. That question alone is worth more than another crown. So if this has changed the way you think about your teeth, the next video to watch is the one I made about why dental work keeps breaking in the first place. It's the missing piece of everything I just covered. Click on the screen now and I'll see you there.